The secrets to be happy. The first secret to be happy is to know yourself. Self-care, particularly vulvar care, may differ from one woman to another because it is something unique and personal. Firstly, you need to keep a relationship or a strong association with your vulva. Understand it the same way you understand the rest of your body and mind when taking care of yourselves. It is an essential and an intimate area, remember that, because many women neglect it, and yet it is the most vulnerable to many changes. So it is time to look, evaluate, and assess. Don't be afraid. Don't be embarrassed to see how it looks or how it smells. It is time to notice how you feel about it. Take a peek, understand, observe, and understand the thoughts and feelings that you uncover as you do your self-assessment and evaluation. If you find perceived abnormalities, forgive yourself. Either you accept it or you seek help when it affects your total wellness and happiness. Moving forward, the more you get to know your vulva, the more naturally you will know what you can do to take care of it. It is time to create your vulvar care story. All right, to reiterate now, remember that the vulva is not the vagina, and the vagina is not the vulva. Let us now go to the second V of our body, and this is the vagina. It is a muscular canal found internally, but connected to the outside of the body through a vaginal opening called the introitus that is found externally in the vulva. The vagina is a passageway that connects the female reproductive system, that is the cervix and the uterus, to the outside of her body. This structure plays important roles in the following: menstruation, sexual behavior, and childbirth. In its youth, the vagina is an outflow tract where your monthly menstrual fluid flows out of your body and where you would place a tampon during periods. So that is a role during menstruation. The vagina has a role in sexual behavior because it is where the penis enters the female body during sex. The vagina also plays a role in childbirth because it is known as the birth canal, as this is where a baby leaves the mother's body during labor and delivery. So this structure, again, let me reiterate, plays important roles in menstruation, sexual behavior, and childbirth. From a medical perspective, the vagina dialogue between the patient and the doctor is one of the most vital yet neglected areas of the female reproductive health system. If only the vagina can speak like the mouth, it probably has a lot of things to say. Without the vagina, many women will be miserable and unhappy. Thus, it is important to understand that the vaginal health is part and parcel of a woman's overall health status. Kaya importante yung kalusugan ng ating puwerta ay inaayos para sa kabuuang kalusugan natin. One must understand that there is life and activity that exist in this closed, narrow, muscular tube. A healthy vagina is equipped with its own delicate and dynamic ecosystem that allows secretion of small amounts of discharge to keep itself clean. Therefore, the vagina is a self-cleaning machine, much as the saliva is produced to help cleanse our mouth. Therefore, all women should be concerned about their vaginal health. To emphasize, vaginal health is dependent on pH balance, and a healthy vagina is dependent on a more acidic pH between 3.8 to 4.2. The vagina is rich in quantities of naturally occurring good bacteria known as lactobacilli that helps maintain the normal pH level and fend off infections and growth of other organisms. It must be emphasized that vaginal pH changes through the course of a woman's life cycle from infancy, the youth, childhood, reproductive and menopausal years, and it is not only dependent on the naturally occurring lactobacilli, but also on the important female hormone called estrogen. Estrogen comes from the ovaries, and it keeps the vagina moistened and keeps it at its most optimum physiologic state. This is very crucial because the normally occurring good bacteria, lactobacilli, feeds on the vaginal cells that are lined by estrogen, and some form of biochemical reaction produces lactic acid. The more lactic acid is produced because your lactobacilli feed more on these vaginal cells that are lined with estrogen, and therefore maintaining the acidic pH. In the newborn, the vaginal pH is on the level of 4 to 5 due to the influence of estrogen from the pregnancy. In the youth and in the menopausic, where estrogen levels are low and absent, the vaginal pH is around 7. On the other hand, because of the influence of the hormone estrogen, in the adolescent, in the adulthood, and the childbearing years, the vaginal pH is maintained at 3.8 to 4.3. The hormone estrogen appears during these important years. It is to be emphasized that the acidic pH protects and prevents growth of bacteria coming from the anus. So, any disruption in this ecosystem may cause vaginal inflammation, vaginal infection, and vaginal dryness. We shall pause for a while, and I'll see you in the next series on the causes of vaginal pH imbalance.